Hey everybody, welcome back to another episode of Between Sessions with Berries. I'm really excited to have our guest today, and I'm not even going to introduce her because her last name is just amazing and I know I'll butcher it. So, Christina, let's just jump right in. I would love if you would introduce yourself and just tell us a little bit about yourself, and then let's dive in because you do so much and we've got just such little time. I want to talk about everything.
Course. So Christina Kantzavelos. And yeah, like I was saying to Kim earlier, it took me 6 years to learn how to pronounce. So I don't expect anyone to get it. I'm a licensed psychotherapist, nomadic, specializing in chronic illness, treating chronic illness, as well as complex PTSD and neurodivergent disorders. And I'm licensed in California, Oregon, Washington, and Colorado, but I'm also a coach, so I can see clients outside of those states and internationally. And I do a few other things. I authored a journal, a bullet journal, a mind, body, spirit bullet journal for healing from chronic illness, but it's pretty helpful for anyone, actually, just like new to journaling. And I have an app based on it coming out soon. I have a workbook coming out soon. So I have my hands in different pots and things at the moment, and a couple courses coming out as well. Yeah.
Yeah, and Christina's super interesting. If any of you follow my other podcast, The Traveling Therapist, I've interviewed her a couple times because she's fully nomadic. Right now, she's sitting in Portugal. She was in Greece earlier, but she's making the whole thing work. And I love that, even with a chronic illness herself. So, Christina, would you share about your personal health journey and how that influenced you to practice the way that you're practicing now with your clients?
Definitely. I became seriously ill in 2018. Prior to that, I had various autoimmune diseases. I mean, I had chronic illness since infancy, but it didn't come to a head to this point until 2018. I was in Mexico. I was doing international work with an NGO, and yeah, became pretty ill, had to cut my contract, come back home, and I was tossed around like a hot potato until someone or a doctor finally diagnosed me with Lyme co-infections, and a plethora of other autoimmune diseases. And this was scary. I mean, I lost everything. I lost my job because you can't exactly faint on the job. I had dysautonomia, POTS. I had extreme brain fog, fatigue, and I eventually lost my home, lost my relationship. So there was a lot of stress and anxiety, and I had such trouble finding a therapist who understood this. I searched all around. I couldn't find anyone specializing in chronic illness. Finally, I actually found someone in the UK, in London. And I was just so grateful because the therapist I had before, I had to give so many subtitles to with my symptoms and what I was experiencing. Like, they really could not understand what I was possibly going through, because it's not just chronic illness, it's everything else that it affects in your life. To go from this person who was essentially like a go-getter workaholic to not even be able to walk across the room, it was hard. It was traumatic. It was literal medical trauma 101. And anyway, in this process, I realized, wow, we need chronic illness literate therapists out there. And the other thing that I looked for was a journal, a mind, body, spirit journal, to just track what I was moving through, to see if there was any positive trajectory. And I ended up having to create my own because there wasn't one out there. So basically, this experience helped me fill in this need for others. And so as I got healthier, I stepped into that role of a chronic illness therapist. And now I'm training others to do the same. So
It's amazing.
we need more. Like, yeah. And if you're listening and you have chronic illness and you're also a therapist, we need you if that's of interest.
Absolutely.
Yeah.
And Christine and I have talked about this. I also have chronic illness. I've got celiac disease. I'm also nomadic, and it is really tough to manage. And when you're down and out, you're down and out. And it is the worst when doctors and therapists don't understand, like you said, POTS and Lyme disease and how it affects the whole mind, body, spirit. A lot of people don't get it.
They do not get it.
It affects everything.
It affects everything. And sometimes unconsciously they'll gaslight you, or they'll tell you, doctors will tell you it's all in your head. Therapists will say you're seeking attention. I mean, the things I've heard from clients who see me is just astounding. It's actually quite depressing. And
Oh my gosh.
yeah.
Yeah. Oh my gosh. Being passed around. It's all in your head. We could talk about this. I know we've already talked about it forever, but we could talk about it even more. So, for the clinician listening, the whole point of this podcast is between sessions. What would you say to a clinician that's like, oh my gosh, I don't even pay attention to chronic illness and how it affects the whole person, the whole client, that sort of thing? Where would a clinician start with chronic illness and even like the medical trauma that comes with having a chronic illness, going from doctor to doctor, therapist to therapist that doesn't get it or says it's in your head? Where does a therapist start with that if they're trying to like beef up that side of their clinical practice and get a little bit more knowledgeable about that?
Yeah, well, first of all, thank you for even being curious, number
Yeah.
one, instead of just ignoring this, because the percentage of people in the US alone with chronic illness is pretty high out there or high up there. And now with two illnesses, it's also starting to really rise, especially autoimmune diseases. The first thing is we have to understand our own lane, right? And there's a mind-body connection, and also there's the different lane for the body part, which is them seeing a doctor. So often, like, let's just take Lyme disease. It has over 300 symptoms, many of which are considered psychiatric. If I were a therapist, I would ensure that the client you're seeing is seeing an integrative practitioner at the same time to rule out if there's anything. Could be thyroid related, could be
Yes.
parasites, could be mold. I mean, there are so many things that can lead to anxiety and depression that are more than what we've been trained to understand.
Oh my
So
gosh.
there's that. And then there are now many more chronic illness therapists out there, and they're putting out some really beautiful content to help you understand the client experience and what that's like. So I recommend delving into that, just delving into whatever resources are out there related to a chronic illness that a client of yours might have or you think they might have, to better understand what they're moving through.
Mhm.
It's really, really huge.
Of course, I remember in grad school, it's like, okay, always make sure the thyroid's tested because that can cause, if it's,
Mhm.
hypo or, hyper or hypo or whatever, it could cause mania or depression, that sort of thing. But that's about it in my memory anyway. There was none of this like, oh, maybe they have a sensitivity to gluten or something that could be causing some brain
Yeah.
fog.
Yeah.
Maybe programs are better now, but when I was in school, there was none of that stuff. And even myself struggling with brain fog and all that comes with gluten sensitivity and all of that, I didn't even know what was happening to me. To have a clinician that says, hey, why don't we just go get some panels run like a functional medicine type
There
integrative
we go. Yes.
physician that actually
Yes.
understands that there's more than
Yes.
just a thyroid level,
Yeah,
I mean,
definitely.
it's so important. So, how do you find a good integrative partner to help on your journey? If you're a therapist, how would you recommend finding somebody that's good with that stuff? What do you look for?
Well, before I go there,
Yeah.
you brought up an important point that so many of these cause neuroinflammation, and that
Yes.
can lead to these mental health symptoms. And I know we talked about it in a previous podcast, but celiac disease for me, I was diagnosed with panic disorder. I was having panic attacks
Yes.
pretty regularly and ending up in the ER. I had severe debilitating anxiety. When I stopped gluten, I would say after, gosh, like 3 to 6 months, my panic
Yeah.
disorder, I didn't even meet criteria for it anymore.
Exactly.
So
Jeez.
it's important to mention that how quickly a simple diet lifestyle shift can change your mental health if it's needed. In terms of finding someone, ILADS, the International Lyme Association of Doctors, they have a directory and list. And even if someone doesn't have Lyme disease per se, these are functional and integrative doctors that are
Mm-hmm.
listed. And
Mm-hmm.
they're going to look at anything that could be the root cause of dis-ease in the body.
Mm,
So
I
that's a
love that.
great place to start as an example.
Oh my gosh, that's so helpful. Yeah. So please, anybody listening, please, if somebody comes to you with just this brain fog or even neurodivergent type symptoms, right?
That's
Because you
another
specialize in
thing.
that as well. But it's like,
Yes.
you've got to
Yes.
suss that stuff out because it's real easy to say, oh, you're so ADD. Maybe you're not. I mean, maybe it's all this other stuff going on. Let's treat all of it and then see where we land with this.
100%. And even with that, it's like when we start doing more trauma informed somatic work, I've also seen the neurodivergent symptoms seem to settle down, calm down. They're not getting in the way as much. So it's addressing everything holistically, I think.
Yes.
Yeah.
Yeah. Yeah. Another cool thing that you talk about, and I want to touch on it because this is for therapists between sessions to heal and be their healthiest selves. What would you recommend to a therapist that's listening, right, that has chronic illness like we do? And how do you manage that? Especially you. You're like nomadic, you're changing countries. Every time I see you on Instagram, you're in a different country, which I love. How do you manage that energy? Like, I've got a full day today, but I woke up and I am not okay. I do not feel okay. What do I do? How do I manage my business and my life when I've got these chronic illnesses myself as a clinician?
Great question. Well, first of all, I'm doing so much better than where I was. When I was really sick, working wasn't even possible. So to get to this point of nomadicism, I have created a very flexible schedule. Like being in Europe, I don't work until the evening, which allows the entire day to nourish and take care of myself and really be with myself and decide, do I have capacity to work today? Do I have the spoons?
Yeah.
And if for some reason I'm not feeling well, which does happen, has happened, again, I run a very flexible practice, including for my clients. If you need to cancel because you're not feeling well, I'm not going to use that against you. And it goes both ways. I'm understanding of them. They're so understanding of me. So it's a matter for me personally, as a clinician, of communication with those I'm working with. Like, here's the transparent truth. I also am still healing from chronic illness. I might not seem that way, right? But I still am. I have some more challenging days and hours.
Yeah.
And it's giving them permission to also take care of themselves. So I see it as a win-win. And so often, and we've talked about this, like me traveling includes getting treatments in these certain countries.
Yes. Oh my gosh. Touch on the one. Please tell them about the thing you did in India.
Panchakarma.
Shouldn't even call it a thing. Just briefly, what Panchakarma? Will you just tell the listeners? Because you really are a model of like, I went through this and I have done all the things to try to get so healthy. And just looking at you, people listening probably don't see her. She just looks so healthy and beautiful right now. It's just hard to imagine you were in a bed and couldn't even function to me. So let's talk about Panchakarma just a little bit because I just think it's the coolest thing ever.
Sure. I had hit kind of a plateau in my health, and I'd heard of Panchakarma from someone else in the Lyme community before, but didn't really look into it. It's hard to find information about it. Basically, it's an Ayurvedic medicine hospital. And generally speaking, you go there for at least 21 days. I was there for nearly 2 months. It's quite affordable because it's India. Like literally 2 months was less expensive than 1 week of treatment, sometimes 1 day of treatment in the US, depending on what it is you're getting. You are detoxing and you're replenishing all at the same time. And so you're getting treatments, sometimes multiple treatments every single day. That is your main focus. They really don't want you working. You are not to like travel around India. You just stay put, the traditional Panchakarma way. So it was life-changing for my health and just for my overall well-being. I cannot recommend it enough. If you have the means, the resources, and the capacity to get over to India, definitely check it out. It's interesting. But like I ended up super glutened and had mold toxicity last time I was in Portugal. And so I went to Switzerland where there was this amazing clinic and had treatments there with ozone therapy and IVs and colon hydrotherapy and special massages. And I was legitimately pregnant, truly, to returning back to a healthier baseline for myself. So sometimes my traveling takes me to these types of
all these
things.
amazing treatments.
Yeah.
Yeah. The gluten belly, right? The big old gluten belly that happens. It's terrible.
It's this idea that in Europe you can't get glutened. I hear it in the community and it's just funny. It's so funny. I have to remain gluten-free regardless of what country or place I'm traveling to.
That's amazing. Let's switch a little bit because on top of being this amazing clinician and doing all this work yourself, you also are entrepreneurial and you've got these other income streams and that sort of thing. So can we talk about the app? Because I feel like you had mentioned that to me before, that the app was coming. So can we talk about the process and then what the app is so people listening know that maybe they could create something like this too, especially the work we're doing? how amazing to be able to take it and then put it out in the world for others to be able to access that work too. They can't work with you personally. So can you talk about that?
Yeah, the app is basically the app version of the journal. What's great about it is that it's aggregating data in real time. Think of your vitals and your nutrition and where your mental health is, and you're able to see that over real time. So let's just say you go to a doctor and they want you, or a therapist, I'd like for you to track your mental health for the next 3 months. You can then literally share that with them, email it to them, or share it with them in person, and they can see how you're doing. And the other thing is to just be able to see how your health is. Like, to connect dots is very empowering, because chronic
Yeah.
illness can feel extremely disempowering. So a lot of people feel that way with the journal. It's like, I was able to see that when I drink or eat dairy, that I feel this kind of way.
Mm,
Because it's funny, this is called, right, in between sessions. It's like really in between doctor's appointments. That's where the magic
yes.
happens. Like, how are you
Yeah.
taking care of yourself? You are your own best doctor. I really believe that for every single person, to take that power into your hands and to see the person you're working with, the doctor, the therapist, as a collaborator more than this person on a pedestal. They're working
I love that.
alongside you, not above you. And it's important to remember that.
Oh my gosh. That's amazing. So to be able to share it with your clinician also, or your doctor or whoever, to be able to
Yes.
say, look,
Who
look, look, I
nutritionist.
had dairy
Yeah.
here, here, and here, and
Yep.
I felt like crap all day. What is up with
Yes.
this? And then even, and I know that we've talked about this before, but it's like you gaslight yourself a lot of
Mhm,
times. I mean,
mhm,
I do. It's like,
mhm.
okay, you feel a little brain foggy, but that's normal. Maybe it's the weather, maybe it's allergies. Like you don't really know sometimes what's happening to make you feel a certain way. At least I don't. So
Yeah.
to be able to like keep track of it like that and then see it laid out for you is pretty amazing. And to have it in
Yeah.
app form, it's so much easier,
It's
especially for
so
nomadic people. You don't have to carry a journal around with you. You could just like pop on your phone and do it. Yeah.
exactly. So creating an app is a process, to answer that part B of your question. Finding a developer who can do this. I mean, if you believe in something you are creating that it is truly, as a clinician, and going to help people on a macro level, I'm all about, if you're listening, go do it.
Oh
Make
my
it
gosh.
happen. You
That
can do it. It's just a process.
it's
So
consistency, right?
patience.
Passion and
Yeah,
consistency.
exactly. That's the magical mixture.
Yeah. Oh gosh, that's amazing. So, what right now, besides all this that we're talking about, what are you feeling currently that you're super passionate about and doing in your life other than all this other stuff? Is there anything you want to talk? I see you at conferences all the time. I see you speaking places. Let's talk about some of that.
Well, I'm supposed to speak at the ILADS conference this coming month, but I don't think
Okay.
I'm going to make it. But that's for, again, Lyme
Oh,
practitioners.
nice.
It's not just Lyme, it's all chronic illnesses. And
Wow.
I also attend a lot of psychedelic science conferences,
Nice.
because I get to work with psychedelics as needed, as appropriate as well. So continued education is, I'm very passionate about that. I'm passionate about constantly learning, because there's so much to learn about. The sky is the limit. Anything I can do to really help spread the word of what is healing that might help someone just a little bit is worthwhile
Yeah.
for me at this point. And I am creating, the course should be out soon, a chronic illness competency course specifically for therapists to learn how to work with folks who are experiencing chronic illness.
So
So,
needed. Oh my gosh,
yeah.
it's so needed. And then the other side of it is, gosh, we didn't even get into this, but I'm going to have to link the traveling therapist episodes to this
Yeah.
so you guys can go listen to this. But the other thing she did was, God, what is the road in Portugal that you did?
The Camino de Santiago,
It's a whole other episode we could talk about, but it's like traveling this pilgrimage through. I mean, how long did that take you that you did that? It's like a hike.
32 days, 500 miles or 800 kilometers. It
Oh
was
my
a
gosh.
lot, a
I
lot.
love that you did that so much. Now is the name of your blog and all of that stuff. Could we touch on that real briefly? Because you're doing so
Sure.
much. I want to make sure everybody knows everything you're doing.
Oh, thank you, Kim. On this path called the Camino de Santiago de Compostela, there's various routes, but they all link to this city called Santiago de Compostela, which is in northwest Spain. And so there's like there's multiple Portuguese routes, for example. And I started in France on the other side of the Pyrenees. That's the Camino Frances, so the French way. So that one's pretty long, but some of them are shorter. And while I was doing it, I was just blogging about it, and I realized I had an affinity with writing and continued. And on this way, I realized trying to find where I can eat gluten-free, and there's
Oh
really no
gosh.
information. And as I began to travel, I noticed there just wasn't a lot of travel writing specific to those who need to maintain a gluten-free diet.
Hmm.
So that's why I started Buen Camino, basically, to talk about all things gluten-free, health conscious, and travel related. So it's BUENQAMINO because the C was taken. Usually it's Buen Camino with the C. So
I love that though. It's a wealth of information. I really love that blog and everything you're doing over there too. So thank you
thank
for
you.
sharing that. And I totally forgot to ask, how are you using AI in your business? Are you using AI at all?
Okay. Yes, this is important. So I was in session and I had a client essentially like, are you paying attention to what I'm saying? Because meanwhile, like I'm writing, I'm typing, I'm looking up
Yes.
something. And I was like, yeah, I was just typing as you're talking. She's like, it just seems like you're not present with me. And oh my gosh, it like really messed me up because I'm like, wow, what if my other clients are feeling this way? What am I supposed to do? And I think it was you who sent an email about berries. I didn't know what to expect or what it would be like. So I looked into it. I had people sign the virtual scribe form to be
Yeah.
able to use it in session. And truly, it has changed my life and
Ugh.
like everything. Okay, so first of all, I am so much more present in sessions because I'm not concerned about
Yes.
typing, writing.
Oh, it's like I got to remember the name of that medication later. Like,
Exactly.
I know, I know.
Exactly. Sometimes I send email recaps to clients with homework or things like this. And I was having to scribble down everything. Anyway, I was like, I look like an octopus basically during session. And
Yeah.
I imagine on the other side of the couch or screen, that probably does not feel great, maybe,
Mhm.
even though you know what I'm doing somewhat. Is she really listening? Is she really paying attention? So now
Yeah.
I'm so much more present. And the amount of time I have saved on proper documentation is astounding. We're talking hours a day because
I
I'm
know.
one of those people who likes to really conduct proper documentation. So it just has been so amazing and helpful in that way for me.
I love hearing that. Are you using AI in any other ways? Because I love to always talk about tech. Like, do you use ChatGPT for chronic illness stuff or any of your
Oh,
business
yes.
building, that sort of thing? I'd love to hear just
Definitely.
about that too.
So, yeah, of course, so many things, whether it's crafting an email or helping with social media, I'm essentially using it as an assistant as needed. And if
Yeah.
there's something more complex that I'm trying to understand, helping a client, I can use ChatGPT to help with that. And I'm seeing my clients do the same. They're inputting their lab results, for example, into
Yeah.
Chat
Yeah.
GPT. And of course, it does not replace a doctor. It does not replace a therapist.
Yeah.
However, it can give you more insight to bring to your next session, to your next appointment. I've had a couple of clients basically diagnose themselves with
Yeah.
something medically, and then the doctor is like, wow, yeah, actually, that might be the case. I'm curious what this is going to look like in the future when it
Yeah.
comes to anything medical. But
Absolutely.
yeah, the only thing I'm just saying is to my clients is like, this does not replace either of them. Like, take it as just more information to bring into session and to bring into your appointments. When there's harm, it's because of, I feel like it can be because of that. So, really
Yeah.
delineating between those two. But to me, it has been such an amazing tool personally and in business and otherwise.
Yeah, I love hearing all the different uses and how people are using it in their lives. Yeah, definitely. My father, I mean, he's early dementia, he's got all diabetes, he's super complicated. And I was at his house for 2 months taking care of him to get him into assisted living. And I was using ChatGPT like crazy to keep track of his doctor's appointments and his symptoms. And you could just go back and consult it and be like, wait, what did Dr. So and so say about his A1C or whatever? Like, go back and consult. I was just keeping all the information in there. And it just made my life so much easier trying to keep track of him. So it's just so many uses, especially with the chronic illness world.
Creating a caregiver plan. I mean, there's so many
Yeah.
things you can literally do with it. For me, so far, it is just, I've literally only had a positive experience.
Yeah. Amazing. Oh my gosh. So, how do people find you? If they want to talk to you, they want to work with you, they want to do any of that, where do they find you?
Yes. So beginwithintoday.com or at beginwithintoday is where you can find me in most places. And then Buen Camino is at BUENQAMINO or buencamino.com.
I love it. Well, thank you so much for coming today and sharing. I hope this really opens some people's eyes. If there's anything you want a clinician hearing this to take away today, what would it be? What would be that one little thing like, this is what I want you to hear?
You are the medicine. You
Mm.
are the medicine. So thank you for doing this work. Just your presence alone is medicine. So yeah, we do some really deep, hard work, and I hope you're proud of yourself.
Oh, I
You
love that
really
so much.
raise the vibration of this earth. So thank you.
Oh my gosh. Thank you. Thanks for being here today.
Thank you, Kim. Thanks for having me.
You're welcome. We'll put all the links in the show notes and everything so you guys can find Christina and all the ways that you can work with her. Thank you, Christina.
Thank you for listening, everyone, or watching.